Hello everyone. So in this video we are going to talk about X-ray of nose and paranasal sinus, and here we will talk about Waters view. In this case the X-ray beam are directed behind, forward, and the nose and chin touch the screen. So as you are seeing in this X-ray, we are able to see the three sinuses except for the sphenoid sinus, plus the zygomatic and the zygomatic arch are clearly visible in this X-ray of Waters view. Now if the similar X-ray is taken with an open mouth, it is known as parieto-canthal transoral projection, that is open mouth Waters view. Now the special thing about this is we are also able to visualize the sphenoid sinus. So an open mouth Waters view gives us visualization of all the four sinuses. Now, briefing it all, in the case of the Waters view, we are able to see maxillary sinus, which is seen best in this case, all other sinuses, plus zygomatic bone and its arch, plus nasal bone, and frontal process of maxilla. So these are the X-ray of nose and paranasal sinus, open mouth, Waters view, and we are able to visualize all the four sinuses. And this arrow, the red one, is pointing towards the maxillary sinuses of both these X-rays. And we are able to visualize the white opacities in both of these X-rays. Now, if we see carefully, the opacity in the left X-ray is dome-shaped and convex upward, and this is likely to be a cyst, whereas a opacity in the right X-ray is concave upward, and this signifies a fluid in within the maxillary sinus. So the left case with a dome-shaped opacity is a case of maxillary sinus cyst, whereas a right X-ray with a concave upward opacity is likely to be a sinusitis filled with a fluid. Now this can be confirmed if it is fluid by changing the position of the patient and taking an X-ray again after 5 minutes after changing the position. Now this is a case showing us the fluid filled maxillary sinus, and we are able to see the air fluid level as labeled. Now contour as we see is concave upwards. So this is also an X-ray nose and paranasal sinuses Waters view. So what we see in the left X-ray is that there are two findings. The first is there is septal deviation with a septal spur, as you are seeing with this red line. The next thing is the maxillary sinus is completely opacified. So this is a complete opacification of left maxillary sinus with a DNS. Whereas in this right image, we see a complete opacification again of the maxillary sinus, but the surrounding margins of the maxillary sinus we are not able to visualize them because there is bony destruction. As seen in the case of left X-ray, the infraorbital margin is clearly visible, but not in the right. So this is a case likely to be of left malignant maxillary tumor. So this is again an X-ray nose and paranasal sinus Waters view, where we see a opacification in maxillary sinus as well as nasal cavity. So this is likely a mass which has started from our maxillary sinus and has grown towards the nasal cavity. So this is likely to be an enteroconal polyp, where we see a left maxillary sinus as well as nasal cavity opacification. Oh, this is a special case seen in the X-ray PNS Waters view, where we see opacification in the maxillary sinus, and the walls of the sinus are really very thinned out, and there is a tooth on the medial wall of the sinus. So this is a case of dentigerous cyst. Now this is a case where we are seeing an X-ray nose and paranasal sinus Waters view, and we are clearly able to visualize the opacification in the maxillary sinus, the frontal sinus, and the ethmoidal sinus of right side. So all the anterior group of sinuses of the right side are here involved, and all of these sinuses actually drain into the middle meatus. So conditions like concha or an abnormal configuration of drainage can lead to this condition of sinusitis involving all the anterior group of sinuses, and this is known as the right pansinusitis. Hope you like this video. Thanks for watching.